5 years ago, I don't think we could have anticipated the successes that have been made in addressing HIV at the country level. There were conversations in the early millennium about what if certain societies collapse. I mean, we're talking about countries where at that time, over 30% of a population is affected or infected by HIV. And how does a society maintain itself under those conditions? So to be at the point where we are now talking about AIDS-free generations, where we're talking about country ownership, and countries are starting to reach universal coverage, which is more than 80% of people who need ARV having access to that. We're talking about making sure that public and private actors, non-profit actors, faith-based, and in some cases even the traditional health sector, that these people are working together to preserve societies that have faced an immense health threat. HIV had, and still does, I mean, we're not over the hump, but HIV had the potential to destroy countries. It takes, it attacks people between 15 and 49 years old. That's your workforce. How can a country maintain itself when that sector of society is dying? How can you have grandmothers caring for 10, 15 orphans and expect a society to thrive? Coming from a patient perspective, we're trying to understand what people on the ground are truly facing. Not just patients, but providers, people who are engaged at the local level. Looking at issues through that perspective, I think, forces you to push the envelope. And I think that's where change comes from. That's where success comes from, and that's where we can truly have an impact with policy that understands that nuance and policy that drives for that change. So from the technical level to the implementation of policy, and then also just to have the opportunity to work within ministries, to have them and help them involve private actors in a more comprehensive way. That's definitely something that I've been impressed with during my time here at CHOPS, and I think that that's one of the ways that CHOPS can really make a difference in national responses.